Are you or someone that you know and care about struggling with high blood pressure and hypertension? Are you kind of confused after you went to the doctor and they said, hey, you need to make some lifestyle changes, and you're wondering what are those lifestyle changes exactly? Well, if that's the question that you have today, you are in luck, because in today's video, that's exactly what we're going to go over. We're going to quickly go over what like a definition of high blood pressure. We're going to quickly look at like what are the different high blood pressure indicators, what are the numbers that you should look at. We're, like I said, very quickly going to briefly go over those pieces, but the bulk of this video is going to be about what are the lifestyle changes that you can make that are going to help you reverse or slow down some of these symptoms and causes of high blood pressure. So we're going to specifically look at the nutritional components of the lifestyle factors, and we're also going to look at the physical activity components of the lifestyle factors for slowing down or reversing some of the symptoms from high blood pressure. But that's not all. We're also going to talk about how weight loss and other healthy behaviors can actually improve your blood pressure overall as well. So stay tuned. Really quickly, I'm Noah Quezada. I'm a registered dietitian, and I specifically help people with weight loss, with turning around some of these health indicators like blood pressure, like blood lipids, like blood sugar, and making sure that everything is in line so that you can live a long, healthy, fruitful life. If you want to learn a little bit more on how we can work together, you can feel free to join my email list in the link below. Before we get any further, please smash that like button, subscribe, do all the things, right, so that this information can get out to more people. That's the whole goal of this. Okay, without further ado, let's jump into hypertension. To start out this whole series on hypertension and high blood pressure, those you'll notice I will use interchangeably throughout this entire video. With that being said, defining what hypertension and high blood pressure really is, I found this quote off the FDA's website, so I'm going to go ahead and read it. High blood pressure is defined as the force of blood pushing against the walls of the arteries as the heart pumps blood. High blood pressure, also known as hypertension, is a disease in which blood flows through blood vessels, arteries, at a higher than normal pressure. Pretty straightforward definition there. So blood pressure is measured with two numbers. The first number on the top is the pressure of the blood vessel when your heart beats. This is also called the systolic pressure. Systolic pressure is the higher of the two numbers. The second number, or the bottom number, measures the force of the blood in the arteries while your heart is relaxed in between beats. The bottom number is the lower of the two and is called diastolic pressure. When we look at these, there's a range for them. So anywhere between 120 to over 80 would be considered within a normal range of blood pressure. A pre-hypertensive or an elevated blood pressure would be somewhere in the range of 120 to 129 over 80. Hypertensive stage 1 would be someone that would have a blood pressure in the range of 130 to 139 over 80 to 89. Finally, a hypertensive stage 2 would be considered somebody that has blood pressure of more than 140 over more than or equal to 90. So it's also important to note here that if you are in that range of 120 to 129 over somewhere in the range of 80 to 89, that would be considered pre-hypertensive. While you wouldn't be diagnosed with hypertension necessarily, you might want to take caution moving forward and start to pay attention to some habits and behaviors. So you might be asking yourself at this point, okay, I have high blood pressure. What is, I'm fine. I don't feel anything. Why should I even care? That's a great question. And that's the question we're going to answer right now. Having high blood pressure and having a consistent high blood pressure over a long period of time is an indicator, right? It might lead to a few diseases down the road. The key indicator of potential heart disease down the road, potential renal disease. I actually found this picture from the World Health Organization. So risks of high blood pressure. If your blood pressure is too high, it puts strain on your blood vessels, hearts, and other organs such as brain, kidneys, and eyes. Persistent high blood pressure can increase your risk of a number of serious, potentially life-threatening health conditions such as heart disease, heart attack, stroke, heart failure, peripheral arterial disease, kidney disease, vascular dementia. If you have high blood pressure, reducing even a small amount can help lower your risk of these health conditions. Prolonged high blood pressure can put extra strain on the little tiny blood vessels within your eyes, within your kidneys, within your heart. Those organs will just eventually no longer be able to sustain that. That's why we should care. It's kind of like if we nip this in the bud early, then we don't have to worry so much about those diseases later on. Lifestyle factors that are going to increase the risk of hypertension and high blood pressure are excessive salt in the diet, excessive body weight, overconsumption of calories, smoking or using tobacco, physical inactivity, age, and alcohol use. These are all going to be lifestyle risk factors that are going to play a bigger part in the development and the progression of high blood pressure. The next section here is talking about all the lifestyle modifications. To start us out, I thought this was a really great quote from the Journal of American Medical Association. In this review for the treatment of hypertension, the first line of therapy for hypertension is lifestyle modification, including weight loss, healthy dietary patterns that include low sodium, high potassium intake, physical activity, and moderation or elimination of alcohol consumption. Generally speaking, we need to lose weight, we need to eat better, we need to work out, and we need to lay off grandpa's old cough medicine. These in combination will help manage blood pressure in the long term. For the first segment of these lifestyle modifications that we can make in order to improve our blood pressure, we're going to start with nutrition. In fact, nutrition in and of itself, we already have a designated diet specifically designed for those that have high blood pressure, hypertension. This diet is called the DASH diet. The DASH diet stands for Dietary Approach to Stop Hypertension. The DASH diet in a nutshell essentially is the idea that we want to include more foods like whole grains, lean proteins, low-fat dairies, fruits, vegetables, nuts, seeds, and legumes, and also limit foods such as foods that are high in saturated fat. So like animal proteins, maybe like a beef that is really high in fat, or your butters, or your whole fat dairies, right? Limiting some of those high saturated fat foods. In addition, limiting some of the high added sugar foods. So your baked goods, your sodas, your candies, your, all that sweet, tasty food. In addition, we're going to want to limit our overall sodium intake. If you put all of these pieces together, that is the DASH diet. And the DASH diet has a ton of evidence supporting it as the go-to diet for helping manage blood pressure and keeping blood pressure within normal ranges. Let's look at a little bit of the research into each of the 5 food groups that are mentioned in the DASH diet. The 5 food groups that are mentioned in the DASH diet are going to be low-fat dairies, lean proteins, whole grains, fruits, and vegetables. Looking at the 5 food groups, we're going to go ahead and start with dairy. There's a study that was published, reports on vitamin D, calcium, potassium, phosphorus, bioactive small peptides, low-fat dairy products, low-fat dietary patterns, and provides further evidence that dietary intake may improve blood pressure and decrease hypertension risk. The unique dairy micronutrient composition together with low sodium, high protein, and bioactive lactopeptides may offer combined protective effects. This also aligns with the dietary recommendations for Americans, which includes consuming roughly 2 to 3 servings or cups of low-fat dairy per day. I think we all understand that eating more fruits and vegetables is going to be good for us, but our next section here is we're going to dive into that specifically. We're going to look at the impacts that fruits and vegetables have on blood pressure and hypertension. Several studies here we'll look at. First, in contrast, our results suggest that greater long-term intake and increased consumption of whole fruits may reduce the risk of developing hypertension. Then we go on to another study. A high intake of fruits and vegetables combined with total fruits was associated with reduced risk in hypertension, while results for fruits and vegetables subtypes were mixed and need further studies. Another one that says our results support recommendations to increase the consumption of fruits and vegetables with respect to preventing the risk of developing hypertension. However, further prospective studies and long-term high-quality randomized controlled trials are still needed to confirm observed associations. So it's pretty clear that fruits and vegetables are going to help with hypertension. Consuming enough fruits and vegetables, somewhere in the range of 2 to 3 servings per day of each. In addition, consuming a variety of different sources is going to widen that net of nutrients that you potentially could catch from those vegetables and fruits that you're eating. So that is going to be the lifestyle recommendation for nutrition under the fruits and vegetables section. The next section that we're going to discuss is going to be grains, specifically whole grains. So there is a significant amount of research that would suggest that the consumption of whole grains would help with the prevention and management of high blood pressure. A refined grain, right? So your pizzas, your baked goods, your cookies, your cupcakes, your donuts, all that stuff, that would be considered a refined grain. And a whole grain would be something like your whole grain pasta or your whole grain, you could use whole grain flour. You could also have whole grain bread. And it's typically, right, not a, super fine or, even super white flour. Rather, it's kind of a brown material. The reason that is considered a whole grain and it can be labeled as a whole grain is because in the production process, they actually keep the whole grain intact. So what they do is, instead of peeling off what is called the husk, which is the outer layer, it contains a ton of vitamins, healthy fats, and vitamins. Instead of taking that off, they leave that on and leave that on in the processing. And so you get all of those nutrients in addition to the grain itself, versus a refined grain like the pastas, like the pizza and the donuts. Right, what they're doing there is they're actually removing the husk, also removing the vitamins, the fiber, and the healthy fats to get just the refined carbohydrate source. That being said, when we looked at the research for the consumption of whole grains and hypertension, more frequent whole grain consumption classified as intake frequency of sometimes or always was associated with lower odds of hypertension compared with zero or no consumption. Consuming more whole grains may decrease the risk of developing hypertension. All right, so we've got one study that looked at this. Here's another study that looked at whole grain incident hypertension in men. Several mechanisms have been suggested by which whole grains can reduce risk of blood pressure. These mechanisms include whole grain effects on increased insulin sensitivity and improved endothelial function. The cereal fiber of whole grain is predominantly soluble fiber and can act through satiety reflex mechanisms to reduce energy intake, which leads to more favorable weight patterns over time. Increased whole grains intakes have been found to be associated with lower postprandial blood glucose concentration and thus could reduce the risk of developing insulin resistance. Intake of oat and wheat may diminish vascular reactivity impairment associated with high-fat meals. In addition, the hypertension consumption of whole grains, wheat cereals have been found to be associated with improved blood pressure control and decreased dose of antihypertensive medications. And finally, we have here whole grain and refined grain intake and risk of hypertension in women. Higher whole grain intake was associated with reduced risk of hypertension in middle-aged and older women, which suggests potential role for increasing whole grain intake in the primary prevention of hypertension and cardiovascular complications. So we have several studies looking there at the whole grain intake and the chances or the risk of a hypertensive episode go down dramatically. So clearly here, again, consuming more whole grains seems to be beneficial for people living with high blood pressure. The last section that we're going to talk about here is going to be the protein section and looking at lean protein sources and its response to hypertension. Specifically, one study here, a moderate increase in protein intake along with low salt and sugar intake has been identified as a possible lifestyle change that can help lower blood pressure. Several amino acids in dietary protein, including cysteine, arginine, taurine, tryptophan, have been shown to have antihypertensive effects in humans and animals. Soy protein have a high arginine and isoflavone content, which contributes to their hypertensive effects. To ensure that hypertensive patients receive adequate protein intake, it is recommended that patients adopt a diet that contains ample amount of protein, such as the DASH diet, which is rich in vegetables, fruits, low-fat dairy products, low in salt, saturated fat, and includes whole grains, lean meats, poultry, fish, and nuts. In addition, hypertensive patients should include adequate supply of soy in their diet. So as far as protein is concerned, consuming a little bit more than normal or a little bit more than average seems to be beneficial. In addition, having a variety of different sources is also going to be beneficial. And finally, choosing sources that are going to be lean sources is going to be the final recommendation for helping with that high blood pressure. So one of the final segments is going to be physical activity. But we can actually break physical activity up into two different components, and we'll break that up into maybe more cardio-based exercises. And then we can also look at the next category, which would be resistance training. Looks like right now the current recommendation, a moderate intensity for a prolonged period of time, somewhere in the range of 20 to 30 minutes, is going to be the ideal situation for lowering blood pressure. We're looking at strength training. I actually found this study called Strength Training for Arterial Hypertension Treatment, a systematic review and meta-analysis of randomized clinical trials. The quote that I'll pull from this study, it goes, "The strongest effect of strength training on decreasing blood pressure was observed in a protocol with a moderate vigorous load, about 60% of a 1-rep max, a frequency of at least 2 times per week, and a minimum duration of 8 weeks. We concluded that strength training intervention can be used as a non-drug treatment for arterial hypertension as they promote significant decreases in blood pressure." Another study looking at strength training stated, "This meta-analysis supports the blood pressure lowering potential of dynamic resistance training and isometric hand grip training. In addition, dynamic resistance training also favorably affected other cardiovascular factors." In an additional study on resistance training, this one, resistance training alone reduces systolic and diastolic blood pressure in prehypertensive and hypertensive individuals. Meta-analysis stated that, in conclusion, resistance training alone reduces systolic and diastolic blood pressure in prehypertensive and hypertensive subjects. The randomized controlled trials studies that investigated the effects of resistance training alone in hypertensive and prehypertensive patients support the recommendation of resistance training as a tool for management of systemic hypertension. So as far as physical activity is concerned, the real takeaway here is simply just not being inactive is really important. But if you really want to get after it, it seems though as about 150 minutes of moderately vigorous activity in addition to 2 strength training sessions per week seems to be at least the most evidence-based approach to your physical activity and hypertension as we have right now. The last segment that we're going to talk about today for lifestyle modifications for managing hypertension and high blood pressure is going to be just weight loss, right? There is a significant amount of research that shows that simply losing weight can improve blood pressure. There is evidence to suggest that these decreases in blood pressure are associated with improvements in left ventricular structure and function and peripheral vascular health. Both exercise training and weight loss have been shown to decrease left ventricular mass and wall thickness and reduce arterial stiffness and improve endothelial function. These data support the role of behavioral interventions and treatments of patients with elevated blood pressure. In another study called Weight Loss in Overweight Adults, the Long-Term Risks of Hypertension, after adjusting for age, sex, education, baseline body mass index, height, weight, smoking, alcohol intake, weight loss of 6.8 kilograms or more led to a 21 to 29% reduction in long-term hypertension risk. After adjusting for cancer, cardiovascular disease occurring during follow-ups, weight loss of 6.8 kilograms or more led to 28% reduction in risk for middle-aged adults and 37% reduction in older adults. Sustained weight loss led to 22% reduction in hypertension risk among middle-aged adults, 26% reduction in older adults. So it's pretty clear here now that we have this, nutrition interventions, physical activity interventions, and weight loss are going to be huge driving forces as far as managing high blood pressure. That being said, there are subcategories within each. For nutrition, we have following that specific diet pattern, the DASH diet. For our physical activity, making sure that we're getting about 150 minutes of moderately vigorous activity and also getting about 2 strength training sessions per per week. And finally, losing some weight seems to improve the risk of a hypertensive episode significantly by more than 20%. So when you put those three together, it's going to compound on one another. So you're going to have the benefits of the physical activity, then you're going to have the benefits of the weight loss because you're having the physical activity and you're following the diet. So it's like they all kind of work in tandem and work together. I really hope you guys enjoyed this video. To definitely smash that like button so that it helps other people find it too.